All right, Chair, you're live now whenever you're ready.
Cheers. Welcome to Health Scrutiny. Councillor Chris McIntyre speaking, Vice Chair of Health Scrutiny, but standing in today as Chair in the absence of Councillor Jones. This meeting is live streamed to our YouTube channel, so if you're watching on YouTube, thank you. I'm sorry you cannot participate, but thank you for joining us. Just a reminder to members, if you have any questions or comments, please go through the chair. We'll move on to the agenda. Item 1, apologies for absence. As I said, we've got apologies from Councillor Jones. Any further apologies?
Yes, Chair, we've also got, sorry.
I've put in Councillor Marsden, please.
Okay, is that everyone?
We've also got apologies, Chair, from Councillor Halawi, and Councillor Cook is substituting today, and we've got apologies from Councillor Philippa Story. Thanks, Chair.
Cheers, thanks for that. Apologies noted. Okay, item 2, declarations of... No, doesn't look like it. All right. Item 3, can we agree the minutes of the last meeting held on the 5th of April 2022, please? I see no objections, so I'll take that as agreed. Thanks very much. Okay, we'll move on to NHS, to item 4, NHS Health and Public Health, an overview. First of all, we have a verbal report from the Director of Commissioning Strategy and Delivery at TVCCG, Craig Blair. So I'll hand over to Craig. Whenever you're ready, Craig, thank you. Oh, sorry, just a reminder, if anyone does have questions, please wait until the end of the presentation. Thanks very much.
Thank you, Chair. And thanks for sharing the presentation, Caroline. I've got a few slides that I'm hoping to take the committee through today, just giving a very brief overview of the planning approach and some of the priorities for the local NHS for the current financial year 22-23, which we're well into now already. So if we can move on to the first slide, Caroline, just really to give a bit of an overview of how the NHS receives some of its priorities and the expectations that are placed on it for each of the financial years we work through. So around Christmas time every year, NHS England produces a planning document which is shared with clinical commissioning groups and provider organisations up and down the country, which sets out some of the key areas that we're expected to respond to. You can see that's quite a long list this year and encompasses a broad range of activities and responses that the NHS has been asked to look to implement, ranging from making sure that we invest in our workforce, supporting recovery from COVID, making sure that we reduce some of the elective backlogs that are in place with some of our acute providers, delivering more activity closer to home, improving the responsiveness of urgent emergency care, so things like emergency departments and urgent treatment centres, ensuring that patients can access those services in a timely and effective manner and receive the outcomes that they expect. Improving access to primary care. We know that during the course of the pandemic, patients have reported that there's been some issues and constraints in accessing primary care in a way that they'd hoped to, and the NHS has been challenged with tackling and addressing some of those. If we just move back to the previous slide a second, Caroline, while I just finish running through those. Thank you. There's also an expectation that we continue to improve mental health services for people with learning disability and those with autism, and continue to develop our approach to population health management. And population health management's a key tool in helping address some of the health inequalities that we have in and across the Tees Valley, in particular in and across Middlesbrough as well. There's an ask that we look at exploiting the opportunities presented through some of the digital technologies that we embraced and utilised during the COVID pandemic, supporting things like non-face-to-face appointments, telephone consultations, and the use of systems like WebEx and Teams to undergo face-to-face consultations, but not in a physical setting. And then finally, there's an ask that systems work together to establish integrated care boards. Integrated care boards are the new NHS bodies that will take on the responsibilities of clinical commissioning groups, from the 1st of July. So as clinical commissioning groups are wound up, the staff and the responsibilities, the functions of CCGs will transition over to ICBs. And I've got a slide coming up just now. If we can move forward, Caroline, that'll set out some of the expectations around the Integrated Care Board across the North East and North Cumbria. Just wait for that to go. Brilliant, thank you. So as I've said, the Integrated Care Board will take the place of the Clinical Commissioning Group and be the NHS Commissioner for Health and Care and Healthcare Services across the Tees Valley and the broader North East North Cumbria area from the 1st of July. And the CCG's identified in collaboration with the Integrated Care Board some key priorities to help transition one organisation into the other over the coming months. So in line with the expectations set out in the NHS operational planning guidance, then we want to continue to rise to the challenges of restoring the various services that we had in place prior to the pandemic and meeting the demands that are now seen on those services and the backlogs that have built up as a result of the response that we put in place to COVID. So many of you will be aware through some of the updates provided at this panel that a number of services were either paused or suspended completely whilst we supported more staff to manage the immediate presenting conditions that the pandemic brought with it. So supporting patients on wards who required admissions to hospitals, etc. To do that, we safely stood down things like outpatient appointments and significantly reduced the amount of inpatient care that was delivered. But what that did mean is as we came out of the pandemic, there was some significant backlogs with waiting times for patients to access surgical treatments. Now, there's been great work already undertaken across the Tees Valley, and in the first quarter of this year already, we've been able to eliminate the longest waits. So those patients waiting up to 104 weeks for surgical interventions, they've now been removed. So all patients that were waiting that long have had their treatment, and that's a real step forward for the Tees Valley and the broader North East and North Cumbria system. And across Teesside, we're now moving towards making sure that nobody waits longer than 78 weeks for treatment, and we're expecting that we'll deliver that standard within the next couple of weeks or months, and certainly by the time we get towards the end of August. There's still a long way to go, and prior to the pandemic, we were working towards waiting times of no more than 18 weeks for surgical intervention. So you can see there's been a significant sustained impact of the pandemic that we're having to deal with, but work is progressing and waiting times are coming down. There's a clear expectation that we'll continue to support the health and well-being of all health and care staff and taking action to make sure that we're able to recruit where we've got vacancies and that we can retain staff who otherwise might have thought about exploring career opportunities elsewhere. So key priority for us at the moment is making sure we hold on to the staff we've got and that we're able to attract new staff into the profession. And Mark and I have recently been participating in some broader collaborative discussions around what can we do as public services and public service providers to work more collaboratively in looking at attracting people into the health and care sector in and across the Tees Valley, looking at how do we grow our own staff and grow our own future nurses, health and care workers, social workers, etc., taken from the local population. And we're just starting off on some hopefully quite innovative and exciting opportunities to try and attract those young people back into health and care services, or bring back people who've previously sought alternative employment opportunities or develop their careers in other directions. So hopefully in future months we'll be able to come back and talk to you a little bit more about that. As I'd said previously, there's a real focus on improving our access to primary care services, making sure that we can improve outcomes and address the health inequalities that we've got across the Tees Valley and in particular within and across Middlesbrough, as well as improving the responsiveness of the urgent care services that we've got in place. And at the moment, we're currently working on the development of something that we're calling a case for change, around looking at how do we further strengthen the urgent emergency care offer that's in place across the Tees Valley. And again, a real focus on the services that are available in and across Middlesbrough, making sure that we've got equity of access for patients irrespective of where they live, and that everybody knows what to do when they're experiencing the need for urgent emergency care, whether it's day or night, through the week or on a weekend. So again, that's something that we'll be hoping to come and talk to you a little bit further about in coming months. And I'll be making some contact with Caroline, hopefully after this meeting, to try and make some arrangements for that. We've got a real need to accelerate preventive programs in the Tees Valley. We know that because of some of the inequalities that we've got, we often diagnose things like cancer too late in the pathway, and many of those diagnoses take place in urgent emergency care settings. So we're not identifying patients early enough, and patients don't feel confident enough to come forward with the signs and symptoms to undergo treatment. And what that means is many of our patients receive poorer outcomes because they are presenting so late in the disease stage. So we're working on initiatives such as the targeted lung health check, where we can target particular individuals who might appear on smoking registers and other registers in GP practices, so that we can get them into diagnostic services and hopefully pick up where they've got signs and symptoms of something more sinister and get them access to treatment at a much earlier stage. Hopefully we're improving the outcomes that they then experience. And the final thing on that list there is around working more collaboratively across systems and places to deliver on all the priorities that are listed there, whilst the organisation, the CCG, transitions into the new Integrated Care Board. And part of that work is around being more joined up with our colleagues in the councils, adults and social care, and other departments as well as working more collaboratively with some of the provider organisations such as the Mental Health Trust and the Acute Trusts, so that we can understand what the needs of our populations are and how we can best go about addressing those as a collective system. And if we could move on to the next slide, Caroline, I was just hoping to really give a bit of an overview in terms of how we're taking some of these national asks and regional priorities and turning them into something that really matters and makes a difference for local people. So I've been doing some work with Mark from a public health perspective and colleagues in both adults and children's social care to understand all of the different asks and the different pressures that each of the departments and organisations is experiencing at the moment. And what we've been able to do is produce the map that's on screen at the moment, which sets out some of the national asks that are being placed on various bits of the system, but also some of the local themes and priorities that are important to us and our population, and how we can weave all of that together into a set of shared priorities for organisations within and across the Tees Valley, in particular health and social care providers. So a example of the output from this work is on the next slide. If we could just flick forward to that, Caroline. What I've done is just provided a brief overview of some of the key themes and areas of joint working that we're hoping to progress as a health and social care system in and across Middlesbrough, with a focus on 5 key areas of adult care, if you like. So hospital discharge and hospital avoidance, so helping get people back home when they've had a stay in hospital, but also helping prevent people needing to be admitted to hospital and providing more care in a community setting, and hopefully supporting people to stay in their own homes. Sustainability, so making sure that we've got the right workforce, the right services and the right technologies underpinning those services to make sure that they're sustainable into the future. Supporting all of our population to age well and making sure that we've got the right level of care and support into and across our care homes. Developing schemes and approaches to using funding streams like Aging Well and the Better Care Fund to target those areas of need across Middlesbrough and the broader Tees Valley, and also improving the outcomes that our older people experience when they do need to access health and care services. Broadening the support available around mental health so that people can remain safe and independent in their own homes for as long as possible, and ensuring that everybody who's got a mental health need can access mental health services at the right time in the right place. And then finally, the 5th theme there is around making sure that we put a real emphasis on our prevention and inequalities agenda, making sure that we provide a broad range of prevention services and initiatives, and that we tackle the inequalities that we've got prevalent within each of our communities in and across the various wards and boroughs within the Tees area. So that's a little bit of a flavour in terms of some of the priorities that have been set at a national level, how they've been translated at a local level, and how we've used some of our local intelligence to respond to some of those themes and the plans that we're starting to develop in collaboration with the provider organisations, but also our colleagues in social care. So happy to take any questions, Chair, and happy to try and respond to those.
Thank you, Craig. Great input for us. Yeah, I'd like to throw it open to the panel. Has anyone got any questions, please? Denise, Councillor Rooney, go ahead.
Thank you. Thanks, Craig. Lots of information there, as usual. I've got a couple of just initial questions. You talked about staff. I wonder if you can give us any information on what the vacancy levels are. And the timescale on transition, I don't know what it is. When will we actually get to the ICBs? And on your mapping slide, you had something on there called funding prioritisation. Can you tell me a bit more about that? Thank you.
Yep, thanks, Councillor Rooney. So in terms of staffing, it's a complex picture. So vacancy rates are reported by each individual organisation. So what I could do is try and provide a summary for you that I can share with Caroline outside of the meeting, and then she can circulate that round. But predominantly we look at vacancy rates across the various different professions within the provider organisations. But if that'd be acceptable, we can share that outside the meeting and get that circulated around. I can take any questions.
Thank you.
No problem. In terms of the ICB, the Integrated Care Board, sorry, I keep using the acronyms, I'll try not to. The Integrated Care Board start date or go live date is the 1st of July. So we've been working through a transition programme for quite some time now, and there has been a couple of previous updates to both this group and the T's, I think the joint T Scrutiny Committee, around the timelines that we've been working along. But again, if it'd be useful, we could recirculate some of those timelines and some of the key decision points that have been taken along the way, if that would be useful. The third point that you made there was around funding and funding decisions. The local NHS receives an allocation which it's able to use to commission the various services that are provided across the Tees Valley. From time to time, there's also additional national funding pots that we can bid for and access. And in doing so, we need to decide what the key priorities are for deployment of those resources. So at the moment, we're working through a process in understanding how we best use funding associated with Aging Well, but also the provision of virtual wards. Virtual wards are a way of providing more traditionally hospital-based care, but in a community setting. So supporting patients to be cared for at home with the right input and the right support, and not need a stay in hospital overnight. And there is national funding available for that at the moment, which we're currently bidding against to try and implement a robust model across Teesside and within Middlesbrough as well. So they're the kind of considerations that we'd work through. We also have the opportunity to bid for various pots of money as a collaborative, so working with colleagues in public health or social care throughout the course of the year. Often we get the opportunity to bid against winter monies, which would usually come out around the summertime, and we'd be able to look at investing in schemes that would support service sustainability and improved access over the winter period, a time when we know there's pressure, additional demand on services, but also difficulties in access as well, because patients can't get out and about as easy. Transport routes can be disrupted, etc. So we have the opportunity to look at doing things slightly different over the winter period with additional investment. But that's the kind of considerations that we'd need to undertake, and that's what I was trying to allude to through the presentation.
Thanks, Craig. Just one point to come back on. My only concern is, and I'm sure it's everybody's concern, that the prioritisation means that some stuff either falls off the table or we don't get enough money to deliver what we want. But that's just a point. Thank you.
I think as a commissioner, that is a situation that we routinely work within. I don't think any part of the Tees health or care system has the resources at its disposal that I might like. So we have to make the best of what we've got, and prioritisation is the best way of doing that. Targeting the investment at the greatest area of need is the approach that we tend to take.
Thanks for that, Craig. Any further questions? I can't see any
I think
hands
Councillor
up.
Cook would like to come in, Chair.
Councillor Cook. Go ahead, Councillor Cook.
Thank you. I'm just wondering if there's any work being done around reducing waiting times for assessments on things like autism and ADHD. I work with quite a few people that have been waiting for these assessments for years now, and one of the worries I have is that it causes such emotional distress that people have ended up taking quite severe paths that could otherwise be avoided. And I'm sort of wondering, is there actually a bigger cost to those waiting times being longer, sort of for those people's care? There's some people I've dealt with, especially with LD assessments as well, that have been in like their late 50s before they've eventually got an assessment, and then for their entire life they've had a substance misuse, or they've had other things which actually, some of it comes down to not understanding themselves. I'm just wondering what work's being done to reduce those sort of waiting times.
Thanks, Councillor Cook. Yeah, there's some significant work ongoing through the Mental Health and Learning Disabilities Collaborative to understand and address some of the concerns and waiting times around access to the services that you've just outlined. I'm probably not the best person, or I'm probably not best placed to provide a more comprehensive answer on that at the moment, but what I can certainly do is take that back into the CCG and make sure that we get an overview provided of the work that's been undertaken. But I think it's well known that the longer patients wait for access to services and treatments, the more significant the impact is on the level of outcomes that they would expect, or they would be expected to achieve. We also know that whilst patients are waiting, they tend to access other services, reaching out for help, which can create or place additional demand on services that doesn't necessarily need to be there. So the priority's got to be on making sure that we bring waiting times down and get patients into the right service at the right time and ensure that we get them the right outcome. So our energy needs to be on delivering that, as opposed to meeting the additional demand that's created by not doing that. But I'll certainly take it back into the CCG and make sure that we get a more comprehensive response on what's happening with assessments for autism services.
Thank you very much. Cheers.
Thanks for that, Craig. Any further questions? I can't see any hands up. I think that's it. Okay. Once again, thanks for that, Craig. We have a second guest speaker, Mark Adams, Director of Public Health for South Tees, who is also going to give us a presentation. So, Mark, when you're ready, please. Thank you.
Okay. Thanks, Chair. I've emailed you the presentation, Caroline, if you got it. Okay, thank you. I thought I'd better let the professionals do this than try and figure out how to use WebEx, which I've not used for quite a while. If you could share the presentation, please. Okie doke. If you could move to the first or second slide, please. Okay, so just considering the statutory duties of public health, so through Section 12 of the Health and Social Care Act, there's a whole raft of mandated functions and duties that are kind of exercised through the Director of Public Health, but obviously through the team and relationships across the system that we develop, and the Joint Strategic Needs Assessment. Craig and I are working on refreshing that across the Tees Valley and locally at the moment, and the same for the Joint Health and Wellbeing Strategy. So there's a kind of odd set of mandated functions that kind of represent various different acts that have come in at various different times. It's not a particularly considered list of mandated functions. So the National Child Weight Measurement Programme is a mandated function. The NHS Health Check is. Sexual health services, which we commission across Tees with the CCG, NHS England, and the 3 other local authorities. Public health advice, the clinical commissioning group, what's called the core offer when the public health transferred into the local authorities to ensure that that public health advice wasn't lost to the NHS. health protection, including prevention, planning, and responding to emergencies, which obviously a lot of time over the past 2 years has been spent on COVID as the most significant health protection issue of, well, my lifetime and probably most people's lifetime. And oral health, including initiation of various forms of fluoridation and oral health promotion, which actually at the moment is delivered through the Office of Health Improvement and Disparities rather than locally, but that may well change over the coming months. And then non-mandated functions that are conditions of the public health grant, so they're not technically mandated, but we have to deliver these through the conditions of the grant. Drug and alcohol services and health visiting and school nursing. And the three biggest areas of spend against the public health grant are sexual health services, drug and alcohol, substance misuse services, and health visiting and school nursing. They take up 85–90% of the budget, if not more than that. So they're the biggest areas of spend, but a lot of public health work is around working with other members of the system to try to influence and support how they're spending and using their resources for greater effect locally. Next slide, please. This is that moving on your machine and not anywhere else, Caroline? Is it not moving on your machine? Oh, there we go. So the Health and Wellbeing Board is the kind of main arena that the joint working is developed through. We've got a shared Health and Wellbeing Board, the Live Well Board, shared with Redcar and Cleveland, and has all the key partners: the NHS, police, Health Watch, and so on. And that's the work of the Health and Wellbeing Board is driven by the JSNA and the Health and Wellbeing Strategy. And in addition to those things, we've got a duty to publish a pharmaceutical needs assessment, which will be going to the Health and Wellbeing Board in September, I think. Keep me moving along, Caroline. That's right. So in terms of what our sort of key areas of interest, who we're for, universal area-wide prevention is critical, but one of the key things, particularly in an area like Middlesbrough and Redcar and Cleveland, is around inequalities. As you know, in some measures, Middlesbrough has some of the most significant problems in the country, and the work that we do with the NHS to try to impact upon that, and more importantly, to an extent, with the wider determinants of health around housing, environment, employment, and so on, to reduce the impact of inequalities is really important. Reducing mortality and morbidity from preventable causes. Craig talked about late presentation for cancer and so on, and the impact that has locally on greater number of emergency care, and more importantly, poorer outcomes for people who haven't been diagnosed early and receiving planned care, and better outcomes as a result of that. And then this health protection function, again, that we've seen throughout COVID, and we're looking to build into business as usual, working closely with the UK Health Security Agency, which is a North East health protection team. And we've developed a number of priority programme areas, which are the 5 that are detailed there: creating environments for healthy food choices and physical activity, which is around trying to impact on and reduce the structural causes of obesity; protecting health and preventing ill health, which is working with the primary care networks and with the acute and mental health trusts. Reducing vulnerability at a population level is largely around the integrated model with substance misuse, domestic abuse, and homelessness, and how we can better support people to help pull themselves out of that situation and move into a more positive situation. And then promoting positive mental health and emotional resilience is the 5th priority programme area. Next slide, please. And our approach is to use this is the population intervention triangle, and I think one of the main benefits of this approach, and we've tried to promote this through all the work that we do with the Health and Wellbeing Board, is that it takes us away from just looking at services. Most of the causes of inequalities and ill health and poor well-being is to do with environment, housing, employment, and all those other things, the social determinants. So if we just focus on services, we miss a big trick. So the population intervention triangle makes us think of what they call civic level interventions, which is the policy level interventions, communities and service interventions. So we need to think of all three of those areas if we're going to have a proper sort of three-dimensional view of what's happening in our communities and how and what it is that we need to do collectively to improve or amplify if things are positive in communities. Next slide, please. So the 5 programs on the left are the ones that I already talked about, and what we're trying to do is make sure that we've got for each of those programs, we also consider the sort of standard stuff around financial efficiency and use of intelligence to inform decision making, which is the JSNA point that I've made, and how we build purposeful relationships with key partners. Most of our what we were looking to achieve we can only achieve by working with partners. There's very little that we can actually achieve independently with the relatively small public health budget and relatively small public health team. So it's about influencing partners. And then the final bullet in terms of the business imperatives, addressing health inequalities with the determined focus on the best start in life across all of those programs. So all 5 programs need to consider how each of those areas impact on best start in life and children and young people, but also where health inequalities play a part in each of those areas. And then the right hand thing is basically the population intervention triangle. How do we consider at a civic, service and community level all of the issues within those programs, so we're not just focused on a service or a kind of medical model. It makes us think more of a community based model than a medical model. Next slide, please. So in terms of the Middlesbrough, the Mayor's strategic plan, it's a bit messy this because some of these were in and then it got changed and now they're in the directorate plan rather than in the strategic plan. So still within the strategic plan under the vulnerability and inequalities bit are the dementia friendly Middlesbrough programme and the age friendly community status, which is an application to the World Health Organization programme. And both of those are really about how can we ensure that the town centre and living in Middlesbrough doesn't disable people, particularly around dementia, by how we operate and behave, but we're considerate of the issues that dementia might play, and places are welcoming and don't create issues with that condition. So the example that's often used is the big black mats. Sometimes when you go into shops, that if you've got dementia, sometimes that can be viewed as a big pit. So people are frightened to go into shops, and just being and you'll have seen the things about coins at checkouts and so on, so people can be helped to live as normal a life as possible while they still also live with dementia. And whilst obviously age isn't disabling as such, there can be things that we can do within town to make it more welcoming for older people around basic things like access to toilets, access to places to sit down in the shade and so on, and also how we communicate and work with older people to shape the town centre. And then that's now in our directorate plan is around the integrated model for domestic abuse, homelessness and substance misuse, and how those services work together better to support people that have one or more of those issues going on, how we can work to help them change their situation. And then the longer term recovery model of jobs, friends and houses, basically employment, housing and social community reintegration, which is recovery from significant addiction, is estimated to take around about 5 years. So it's a significant supported program, and actually the environment that you live in is part of your recovery. So connecting people that have been accessing our services for substance misuse into volunteering opportunities, into employment, into decent housing and so on is part of the recovery journey, so that they don't relapse back into the addictive behaviours. And then the second strategic plan priority around Middlesbrough Children Matter, we've got a programme working across Middlesbrough and Redcar and Cleveland, looking at the first 1,001 days of life and how we can impact on that, working with maternity and other services to ensure that the inequalities that we see at that very early stage of life are as minimised as much as we possibly can. Next slide, please. So this, I think, is the final slide, just in terms of issues and opportunities. As I've said, relationships are critical. We can only really deliver what we want to deliver with relationships with other council departments and with other partners like the primary care networks, the CCG, the acute trusts, the voluntary and community sector, and so on and so on and so on. It's all through influence in the main rather than any sort of direct authority over what might happen. The potential to build on the whole council response to COVID-19, if we could have a similar whole council response to childhood obesity, for example, we'd be at a different place to where we are now, and how we might go about influencing that. We're doing some work in terms of trying to improve and clarify the role of the Health and Wellbeing Board, so that we can have it as a real place for collaboration and working together. And linked to that is building mutual agendas. Where's our shared agenda between the foundation trusts and the primary care networks? And we've done some really good work with the primary care networks on looking at the impact of debt and on mental health, and how can we work to get what people are due through welfare support into their pockets, and understand the impact of that on improving their mental health. And conversely, people with that have got mental health issues, understanding what debt issues they've also got, and can we work to support that with the sort of GP as the point of contact, which it often is for issues that actually have their root causes in social issues rather than health issues. But how do we work across that divide? In terms of capacity and capability, recruitment and retention is critical. You'll know Catherine Parker and Esther Miraku, who are two public health consultants who now work in the NHS. So we've got 2 vacant posts, been vacant since October, but in that time I've been working with Craig and the NHS to get a shared post with the NHS, and with Paul Crawshaw at the Teesside University to get a shared post with Teesside University, and a sort of standard local authority post too, and they'll be going out to advert shortly. So the time has been spent trying to build interesting and different posts, because it's a difficult recruitment market, and hopefully they'll both be posts that will make a significant difference working across the system, but also be attractive for people to come and work in there, because there's a real shortfall of public health consultants. Getting the balance right as a SLT service. When I was the assistant director in Redcar, I spent most of my time saying we weren't getting our fair share from public health SLTs. So now I'm at the other side of the fence, having to articulate why that's the case. But there's issues that we're working through. There's a governance board that sits over public health SLTs. We're doing everything that we can to try to make sure that there's an equitable service and equitable advice and support for both council. And I think we're improving that. The Live Well Centre, as you know, is in the Dundas Arcade, and is a really important model in terms of service integration, because we've got services that work together and make sense together, including things like welfare support and Job Centre Plus and services like that we're connected into. But we're looking at the relocation of the Live Well Centre potentially into a council-owned space. So how do we build the value of that as a service, but also as a way of bringing footfall into the town centre, and potentially being considered as more of a kind of anchor tenant in that situation in the town plans. And then community wealth building and anchor institutions. The NHS have all got responsibilities as anchor institutions. I keep saying we kind of know the tune, but we don't really know the words. I think there's a little bit of filling in about what that actually means and how we can get the most benefit out of that. But it's really around retaining the resources that we have through the council, through the NHS, and through other partners, retaining resources in our community as much as we possibly can. And I think that the health and wealth stuff that the scrutiny panel have previously done is linked into that. How can we get better value from the resources that we spend, thinking of a slightly different things what we normally think about in terms of how we build job roles? And Craig talked about the work that we're starting to do on inclusive employment. The sort of thing that sums it up for me is people keep saying, now we're in a position where it's more difficult to recruit to roles, that we're all fishing in the same pool, but we're making the pool smaller than it needs to be, because we're still using kind of now slightly outdated ways of selecting people around GCSE levels and so on, when actually if we recruit for values and behaviours for the post where that's the right thing to do, and then build English and maths and whatever other skills we do, we're potentially going to end up with a more empathetic and capable workforce in the things that you really want them to be empathetic and capable in. And also thinking, how does that then become a career opportunity? How can we support people coming in at that entry level position to potentially become social workers or physios or nurses or whatever the case may be? This is very, very early stages about this, but I think it illustrates how we need to start thinking differently about a lot of this stuff, and how we're more inclusive in our thinking across all of our communities, rather than where we would normally draw staff from. And then just in terms of uncertainty, we've brought a lot of resource into both Middlesbrough and Redcar and Cleveland through the Sport England programme, Changing Futures programme, Project ADA, and so on, and they're all non-recurrent. So, and there's also government funding that's non-recurrent. So we're kind of working on a sort of going concern basis that we're still going to continue, but there will come a point when some of that resource disappears, and what that means we'll have to work through the kind of exit strategy from each of those programs. The kind of mood music in most of them is that funding will continue from somewhere, but it's not certain at the moment. What's the thing of verbal agreement isn't worth the paper it's written on. It's all a bit like it's that kind of situation. So I think it's okay, and it's better that we've got the resources, but there is that risk when those resources come to an end. And I think that's yeah. I didn't have a jazzy little questions slide, but happy to take any questions.
Thanks, Mark. Yeah, any members have questions? Councillor Davison, I see your hand up. When you're ready, Councillor Davison.
Right, thank you. Thank you for that, Mark. There's just one thing I would like to ask you, and you did mention it in your first sheet of your presentation, was regards to oral health and the huge problem we have within Middlesbrough with dentists and people being able to go to dentists and being able to sign on the NHS. It seems to be a huge problem. Are we working, I don't know whether Craig could maybe answer as well, are we working with this section to try and make things easier for people to access a dentist?
It's oral health prevention, so it's not quite the same thing, but I
Oh.
don't want to use that as a get out to dodge your question. I did ask on the back of a query about accessing dentists for asylum seekers as it happened, but I think the issue is broader than just as I think it's everybody has an issue accessing NHS dentistry, and I have got a response which I can potentially use to develop a response through Caroline in terms of what the current position is. I think, and Craig might want to add to this, although I think it's Karen's area rather than Craig's. I think there is an issue, and the NHS is working through it. But I know from personal experience, it's quite. I live in Darlington, not Middlesbrough, but it is difficult to access a dentist, and quite often get councillors asking me to facilitate access to dentistry for families that are struggling to. So I appreciate it's an issue, but it's an NHS. I think it might be an NHS England responsibility, Craig, is it, rather than a CCG?
Yeah, one of the complexities that was created when CCGs were established back in 2013 was that responsibility for some NHS services was split across different organisations, and dental care sat with NHS England. Over the next 12 months, there'll be a piece of work undertaken to help transition the Commission of Dental Services over to the Integrated Care Board, so it'll sit back with local systems. So we'll be able to have more direct influence over what the responses look like. But at this time, it does still sit with NHS England. So I think I've seen sight of a response that's gone to Mark that one of my colleagues was copied into. I think best thing to do is probably provide a response outside the meeting where we clarify a few things, Mark.
Yeah.
Yes, that would be amazing. Thank you. That's all I have for you. Thank you.
Thank you.
Any further questions? I can't see any hands up. Okay. Once again, I would like to thank Craig and Mark for their inputs. It was very valuable. Thanks so much. If you need to leave, by all means do that, but obviously you're quite welcome to stay for the rest of the meeting should you wish. Okay, thanks again. We'll now move on to item 5 on the agenda, and this is setting the scrutiny panel's work programme. I'd like to bring in Caroline to say a few words about this. Caroline?
Thanks, Chair. Obviously, it's the first meeting of the municipal year today, so it's really for the Health Scrutiny Panel to give some consideration to what topics it would like to look at in more focus over the course of this year. I think there's quite a few suggestions there on the work programme report, which hopefully members have had a chance to have a look at in advance of today's meeting. And obviously Mark and Craig have discussed some of the things that they've got coming up and some of the areas that they see as being key issues and challenges for the year ahead that the scrutiny panel might be interested in looking at in more detail. So really it's just to invite some comments initially from members about any views that you might have in terms of the areas that have been suggested, whether there's any other particular issues that either have been raised by residents or from members' own experiences that they feel as though that there are concerns around, and we've obviously got some suggestions there from Health Watch as well in terms of the pieces of work that they've been doing, and some of the areas of concerns that have been raised in relation to the feedback that they've received. So I just return that back to you, Chair, if you'd like to invite some comments from members, and we'll go from there if that's okay. Thanks, Chair.
Yep, that's great, Caroline. Yeah, has anyone got any ideas, any comments? That would be most welcome.
I think Councillor
Cook is
just on behalf of Councillor Halawi. Yep, just on behalf of Councillor Halawi, she asked me if we could recommend a sort of quality of service review of GP practices in the town, to ask what sort of wait times there are, appointment time, like how long you have to wait for an appointment, and those sort of other like key statistics that would affect the quality of service, and what the sort of challenges that the GP practices believe that they face, just to try and get an overview of what each practice service delivery and challenges.
Thanks for that. Councillor Story, go ahead with your comments.
Thanks, Chair. Yeah, I think what Councillor Cook said makes a lot of sense. I think GPs, the stress they're under, that's obviously a national issue which has a real local impact, and I think that's a good topic. I think looking at the list of topics, the dentists, and I know Dorothy's already talked about dentists, but I definitely think a topic on dental provision of service in the area is important. I know from my work working for the MP that it's a major problem across Middlesbrough is getting registered with NHS dentists. And I'm also aware that there are 3 dental practices in Middlesbrough which are consulting at the minute on merging and moving to a kind of super amalgamated dental practice, which is actually outside of the borough, and closing 3 smaller practices around the town. So the provision is quite is changing, and I think it'd be quite interesting to try and get some picture of how dental health services are provided and what can be done to make sure that gaps are filled, because I do feel like it's putting a lot of stress on local people. When you read some of the stuff about DIY dentistry that people having to do at home, I mean, it really is quite worrying to see that. So yeah, I definitely think dental health is something we should look at.
Thanks, Councillor Story. Any further comments? Councillor Rooney, go ahead.
Thanks, Chair. Yeah, just echo what both Dorothy and Matt have said about dentistry. I think it's an area we should be looking at. Poor dental health can lead to lots and lots of other conditions, which really affect people. So I think I'd really like to support that. I'd also like us to look at the children's autism pathway, which was a new thing I think was on the paper that was sent out. Something that's been just recently introduced. I think I'd like some information on how that's operating as well. Thank you.
Thanks for that. Any further comments? Councillor Story, go ahead. Councillor Story, did you have a question?
Sorry, yeah, thanks, Chair. Whether or not it's something that should be a full topic, I don't know, but I do think it would be useful if we had some degree of investigation into NIAS and ambulance services. There've obviously been some really horrifying stories about how the sort of strains on ambulance services have left some people in most horrendous situations. And I know that local members of Parliament have taken this up recently in a debate in the House of Commons. But I think I remember when I was political assistant at the council, Eddie Dryden, as the former Labour chair of this panel, did a fantastic piece of work. I think it was about 2009 actually, when NIAS were planning to move the call centre from Teesside up to Hebburn, and a lot of the concerns that were raised through that investigation, and it was a very wide-ranging investigation actually, which included all the Labour members of Parliament, Stockton South, Stockton North, Middlesbrough, and Middlesbrough South and East Cleveland. It was a very wide-ranging discussion, which had raised a lot of concerns around the lack of local knowledge, and if you move the service to a regional centre in the north of the region, do you lose something in terms of local knowledge, and what impact might that have on the service going forward? And unfortunately, many of the criticisms made in that 2000, I think it was 2009, I can't remember if it might have been slightly earlier than that, but that report itself stressed that these kind of issues could present themselves, and now they have. And I think it would be useful to hear from NIAS about what they're doing and what they're putting in place to make sure that ambulance services are working as best they can on Teesside, because we have looked at this before and we have raised those concerns, and to an extent we've been proved right actually, that there have been stresses in exactly the way we expected it would be, and I think that's something that we could look at. Whether, as I say, it may not be a full topic, but I'd certainly like at least to hear from NIAS and have them come to a meeting so we can ask them some questions.
Thanks for that, Councillor Story. Councillor Davison, go ahead.
Yes, can I just come in again? Actually, Matt, you're totally right on the date, because I was on that scrutiny panel at the time. And maybe, I know it's a long time ago, but maybe if we could pull forward that report as well, just to work with, to see how different things are now, and see if we can improve. I totally agree with that one as well, Chair.
Yeah, I totally agree as well. My inkling is to go forward first of all with the dental practices. Any thoughts on that? Would that be acceptable?
I would agree with that,
made
Chair.
a start on the dental. Thanks, Dorothy. Cheers. Right. Hold on. I'll bring Caroline back to it. Do you think that one's doable, Caroline? Is a viable topic to look into?
Yes, obviously. I mean, dental health's obviously been an issue that's been raised previously by members of the panel, that there are concerns around it, and it is a national issue as well as a regional and local issue in terms of the commissioning of those services. I think it would just be, as those are currently commissioned by, I think Greg said NHS England, it might be without a sort of the people that we would need to invite maybe at a more national level than a local level in terms of what's happening. I'm not sure whether, and Craig's got any advice on that at the moment in terms of who would be the best point of contact to start an initial discussion on that. I am aware that there has been, as Matt made reference to, about potential merger for some services, NHS dental services within Middlesbrough, and to possibly close some of the existing services. And I can forward some information that I've received on that to all members of the panel as well. I don't know whether, Craig, if you want to come in there about anybody that might be a good point of contact to get any sort of initial overview in terms of the commissioning arrangements and how the structure works.
Yeah, the NHS England local commissioning lead is a lady called Pauline Fletcher. I can put you in touch with her, Caroline. Pauline will be able to give you an overview of what the current arrangements are, what the current service gaps are, any specific pressures, etc. It might be worth considering whether or not there's an opportunity to link up the interest of this committee with the interests of some of the other Tees Valley committees as well, and have a joined up conversation across Teesside, given this is an issue right across the whole of the Tees Valley. So something to consider perhaps.
Would members be happy with that in terms of if we get, it might be a case, as Craig pointed out there, that other health scrutiny panels within the Tees Valley might also be choosing this as a topic of priority at the moment, given some of the concerns that members are expressing that they're well aware of. So we'll certainly put that down as the first topic that we'll look into, and I'll speak to my colleagues across the Tees Valley as well. And then in terms of the other topic areas as being highlighted for this year, I know that obviously reference was made to the quality of service review in respect of GP practices, as well as the children's autism pathway and the current issues that NIAS have been facing. So if we put them down as sort of the 4 main areas of that we'll try to cover over the course of this year, some obviously such as the dental practices, it'll be a more in-depth review. And it might be that we just have a one-off meeting where NIAS come along and I'll send out a copy of the previous report that was undertaken in respect of the ambulance services, circulate that from when that piece of work was done previously. I am aware that it was a very comprehensive report that was done on that quite a few years back now. If members are happy with that, we'll put that down as the programme for this year and forward that on to OSB tomorrow to be ratified, if that's okay. I don't know whether Mark or Craig, from their perspective, have got anything else that they feel as though we should be prioritising as part of the work programme for this year. Thanks, Chair.
Thanks for that, Caroline. Mark and Craig, is there anything you would like to add?
I think they're all good, interesting topics. I guess just to add to the list was I think in March there was a presentation to the committee on preventable deaths, and I think what would be really interesting will be to look at accessing services, particularly around screening and immunisation. Links into the point about late presentation for cancer, but from a community perspective rather than from the service perspective. What do we know through VCS organisations that support people through those sort of pathways about, and from people in the community about issues that are preventing accessing those services? I think that kind of different perspective would be really interesting, because it's a critical area that we need to improve, and I think it would be quite tricky to do in many respects, but I think it would be a really interesting area to have some time on.
Yeah, cheers. Well, I think we've got enough.
Chair, if I could take a liberty, it would be absolutely support the what the committee have said around dental, and obviously if individuals are having access issues with dental services, then they do tend to present at other urgent emergency care facilities, creating further pressure within the system. So I think we absolutely need to understand and address some of the dental concerns. But off the back of that, it would be really good if we could have the opportunity to come and talk to you in some more detail around the case for change and potential opportunities to enhance the urgent emergency care offer in Middlesbrough, because I do feel at the moment that there is a broader offer in place in other localities in the Tees Valley, and perhaps the population of Middlesbrough don't have equity with some of those other localities in terms of things like urgent treatment centres. We don't have an urgent treatment centre in Middlesbrough, but we do in Redcar, we do in Hartlepool, and we do in Stockton.
Yeah, good point, Craig. Absolutely spot on, to be honest. So yeah, I think the one that must take the priority for now is the dental health care. If we can go with that and then see how that goes, and then we've got the other subjects we can check out once we've examined the dental health care. Would everyone agree with that?
Yes, Chair, could I just possibly mention one other thing? With regards to the dental care, could we also organise within that for the oral care that Mark talked about in his presentation to be included in that? Well, I don't know what anybody else thinks.
Well, yeah, I think they are sort of linked, so one would follow on from the other. So I don't have a problem, going with that at all. Any further comments?
I would just support that. I think it makes sense to consider it in the whole piece, because the prevention and the work with school children and so on is an important part of the picture. Not the same, but part of the same picture.
Totally agree. Caroline, have we got enough there?
Yeah, so I was
Yes,
just
sorry.
going to say, Chair, is it okay if I come in there just to say, obviously, so for recap, we're going to do the dental care first. We're going to potentially look at the quality of service provision in terms of the GPs, NIAS, and then in terms of the other areas that Mark and Craig have highlighted, the preventable deaths and looking at making sure, finding out a bit more understanding from a community perspective about why people present late. And then also from Craig's perspective in terms of ensuring that we get the case for change presented to us in terms of the emergency, sort of urgent and emergency care services and where we are in relation to the other authorities within the Tees Valley. If everyone's happy with that, if I put that forward for the OSB tomorrow, would that be okay? Thanks, Chair.
Yeah, I think we all agree on that one, Caroline. Yeah, go ahead and present it to the OSB. Thanks.
No
Okay, I think we can move on now to item 6 on the agenda, regional health scrutiny and update. This is about the visit to Rosebery Park. Have we got anyone who could give us an update on that, who went there?
So, sorry, Chair. I think Councillor Alma Halawi was one of the members that went on behalf of the Tees Valley Joint Health Scrutiny Committee, but obviously she's put her apologies in today. But Scott Bonner, our DSO, was also there, so I think he'd be able to talk a little bit about the visit and what happened on that visit as well, just to give members a bit of an overview. Thanks, Chair.
Thanks for that, Caroline. Yes, Scott, are you happy to make some comments about the visit?
Yes, Chair, thank you. Yes, it was very informative visit. I was there in support capacity, so in terms of the substantive element of the meeting, I wouldn't be able to provide as much of the detail that Councillor Halawi will be able to. But it was extremely reassuring that all members in attendance and all support officers were extremely reassured by the work that CHUV had undertaken to address the issues as part of the report and the inspection report that had come out. So overall, I can't provide any major detail for the committee here today. However, I can advise that all members involved were reassured by the work that was undertaken.
Thanks for that. Yeah, thanks for that, Scott.
I think Councillor Bell would like to come in, Chair. Sorry, I think Councillor Bell would like to come in, Chair.
Cheers. Councillor Bell, go ahead.
Could I just ask that it's the report from Councillor O'Reilly comes on the next meeting we have, so we get a better overview of what happened? If that would be
yeah,
okay.
It sounds reasonable, Councillor Bell. We should be able to arrange that.
Yeah, could I also just mention, sorry, could I just mention as well, Chair, sorry. So at that particular meeting as well, in terms of the Tees Valley Joint Health Scrutiny Committee, that was the meeting where the membership from across the Tees Valley looked at the quality account document for Tees Esconway Valley's NHS Foundation Trust. Every year they obviously produce a quality accounts document, which the Tees Valley Joint Health Scrutiny Committee is asked to comment on behalf of all 5 of the local authorities within the Tees Valley. So they presented that at that meeting at Rosebery Park, and then a response was drafted, which will form part of the quality accounts document itself. So I'll forward a copy of that response from the Tees Valley Joint Scrutiny Committee to everyone on the panel as well, just so that all members are aware of the comments that members made at that meeting, if that's okay. Thanks, Chair.
That's fine, Caroline. Thank you for that. Okay, we'll move on. Item 7, I believe, overview and scrutiny board update. This incorporates 2 meetings. First one on the 27th of April, second one on the 11th of May. Both meetings did include a couple of subjects that were the same. So what was included in both the meetings was the update on the Executive Forward Work Programme, an update by the Chief Executive, and Scrutiny Chair updates as well. Okay, so if we go back to the first meeting on the 27th of April, also included in that meeting was a discussion about school exclusions with secondary school representatives. And also we got the final report on green strategy by the Economic Development and Infrastructure Scrutiny Panel. moving on to the meeting on the 11th of May, we had input from Councillor Hill and Councillor Grange talking about their executive roles. We also had a final report on locality working from a children's services perspective. That about covers everything, but I mean, if you need any further information, it's all on the internet now, so you can you know, go on the internet for more details. Okay, we'll go to item 8 on the agenda, proposed meeting schedule for 22-23. My suggestion, and I think a lot of members would agree, is that perhaps these meetings are a bit late, especially if they sort of extend to over 2 hours plus. So an ideal, well, I think what would be ideal would be a 10:30 a.m. start. I would like to bring in Caroline. Can you just
yeah, thanks, Chair.
Explain a bit more about.
Yeah, thanks, Chair.
Yeah.
In terms of the dates of the meeting, obviously we've got to try and get dates that will fit in with everything else and doesn't have any clashes with the diary in terms of other scrutiny panel meetings, planning, licensing, etc. So the panel normally meet on a Tuesday, and it's generally been at 4 o'clock. I think the Chair's preference would be to have it a little bit, maybe a little bit earlier in the day, 10:30 or 1:30, and so she just wanted to raise that with the panel today to find out whether that would be convenient for the members as well. Thanks, Chair. So just really for discussion on that, and for the officers whether they will be available at those sorts of times on that day as well, because obviously they play a key role in contributing to the work of the panel. Thanks, Chair.
Absolutely, Caroline. Has anyone got any comments then? Were we able to do morning meetings?
I'm fine with the 4 o'clock. I really don't mind it. It fits quite well with me.
Would you be able to change your plans if we scheduled it earlier?
Well, Tuesday's a working day for me, so if it was earlier, it would take a big chunk out of my working day, which is why 4 o'clock is best for me.
Councillor Bell.
Yeah, I'm of the same. I work on Tuesdays, so I was 62 today, so I can get to the meeting either at the town hall or virtual. But if it was 10:30, I wouldn't be able to get the way any of them, I don't think. So I'd be really struggling.
Right.
There's no worries, Chair. I can go back to I'll go back to Councillor Jones. I don't think it was a case of that. It was just a suggestion in terms of, so it was just to get some feedback from members of the panel as well, of whether that would be something that they would like to consider, or whether maybe did a mix of both later and earlier meetings. So if I just leave them for 4 o'clock at the moment and then come back to the panel, would that be okay with everyone? Thanks, Chair. I'm not sure whether you're on mute, Councillor McIntyre.
Yeah, I was on mute. Sorry about that.
No worries.
Yeah, I was just saying yeah, we'll proceed as normal then, as what is normal for us, and that's 4 p.m. For the day of the meeting, and see how it goes. Okay, so let's move on. Item 9, any other urgent items? No, I don't think there is. No one wants to raise anything? No. Okay, looks like I can close the meeting now. The next meeting will be on the 19th of July, and thank you all very much for your input and for attending. Thank you.
Bye.
Bye.